Dr. Mytien Goldberg. I'm a board-certified plastic surgeon here in Beverly Hills. I'll show you a really interesting and amazing case on my beautiful patient here today. She's gone through a weight loss journey of 135 pounds. You are a new person today. First stage of what we call the body contouring. First, we did a breast lift and augmentation. So you can see here, we did a very natural breast augmentation and lift. We maintained all the patient's natural breast tissue and put in a very reasonable 325cc implants. And this was done above the muscle. For women, active women like my patient, putting the implant above the muscle is a very important factor. What I call a subfascial breast augmentation. It still maintains the function of her pectoralis major muscle. Believe it or not, we use that muscle every single day in our life, whether we're working out or working in an office, daily chores. And by putting it above the muscle, you don't have this animation deformity. What is animation deformity? It's when the breast jump or the implant jump when we activate that muscle. And so for before and after pictures, in the static pictures, the subpectoral breast augmentation looks great because, you know, in that picture, the patient is not moving. But if you can flex your muscle, pretend like you put your arms together for me and flex it. See, you don't see any funny animation deformity at all. So this is a great way to do a breast augmentation. Don't let anyone else tell you otherwise. Oh, subpectoral will maintain the longevity of the implant. Not true. The other reason why subfascial breast augmentation is great is that you have a very nice natural silhouette. When you turn on the side, you have a very nice slope natural breast contour. Okay, the other thing that subfascial breast augmentation is great, over time, the patient is now 8 weeks out from surgery, you can kind of see the swelling is going down. The implant sits right at the center of her breast. It's not being artificially kept up high, up in the breast. So in a massive weight loss patient, you don't have this, what we call the waterfall deformity, where the implant sits up here, but the rest of the breast sits down here, even after a lift. So this is a great technique for breast augmentation in massive weight loss patients. In this first stage of body contouring, we did a bilateral breast augmentation mastopexy along with a medial thigh lift. So for a lot of massive weight loss patients, the medial thigh excess skin is often a problem for daily activities of living, including working out, ability to wear really tight clothing. And so we remove a lot of the excess skin in the medial thigh, but the key here is scar placement for the thigh lift. And you can see here, medially, it put right just in the silhouette, the contour of the thigh that can be well hidden. And when you stand straight, you could barely see the thigh, and you could see her thigh gap. So the natural contour of the thigh is really nicely. From the back side of the thigh, you could barely see the scar except for the most distal aspect of the incision. So I think this is a win-win, outstanding result on a first stage body contouring. So